Good afternoon and welcome to Leadership Health and Wellness, where we dive into topics that matter to your physical, mental, and emotional well-being. Today we'll be focusing on an important topic, addiction. Addiction comes in many forms, from substance abuse to behavior addiction, and it can have an profound impact on one's life. So to help us understand this complex issue better, we'll be having a distinguished guest via virtual, Dr. Peters Oyebola, who is a clinical psychologist. Dr. Peters, thank you and welcome to Health and Wellness on Leadership TV.
Thank you for having me.
So, sir, can you please help us define what is addiction truly is, and how does it differ from a simple habit or overindulgence?
Okay, thank you very much. So there's a distinction between habit and addiction, and I'll try to make it as simple as quick as possible. If you have something that you call an habit, with determination, you can actually stop it. If you put your mind to it, you can actually stop it. If you work towards it, you can actually stop it. However, when we are talking about addiction, we are talking about something that there is an underlying physiological process inside internal system that make it difficult for an individual to stop it even when he wants to stop it. For example, when an individual is addicted to something, whether it's substance, whether it's pornography, whether it's behavioral addiction, whether it's sugar, whether it's gambling, there is something that make it difficult for that individual to stop it. We could talk about things like withdrawal, we talk about things like cravings, so all of these things, right, make it very, very difficult for an individual to stop. And we always say that there is a thin line between abuse and addiction, but you crossing that line from abuse to addiction, you can't see it. We say an invisible line. But once an individual move from that abuse to the addiction part, right, usually the person will not be able to get out of it without a professional help, right? So those are some of those things. And in the case of addiction, the person still continue that behavior despite knowing that there are negative consequences, right? So that's why it's actually very, very difficult.
So, sir, what are some of the earlier signs of addiction, and how can that people might overlook?
Okay. Um, okay, so I would take it from the behavioral standpoint. When an individual, okay, because there are two forms of the addictions, right? So we have behavioral addiction and we have substance addiction. So we have to make that distinction. I think it's very important. So when we say, let me try to just touch on the one that seems very, very endemic and very, very common. That's the substance addiction. Now, once an individual starts an addiction, especially to many of these, psychoactive substances, one of the first thing you notice that the pattern of friends changes. Why? The pattern of friends changes because they say bird of the same feather, then they flock together.
Flocks together,
So
yes.
exactly. So the friends that don't use will be criticizing you. So you want to be with people who will accept you, right? Who will not critique your behavior. So the
Yeah.
other things you will like notice that there will be withdrawal from friends, from friends and all that, right? So the individual will not want to be seen, right? The individual will not want to be seen in that state of highness. So there's a lot of cover up, there's a lot of lies, just to just to hide. There will be a lot of manipulation. Somebody you probably see a lot of behavioral changes in the individual. Someone who is not aggressive, for example, you start to see that level of aggressiveness. There's this confidence that comes in. There's a lot of manipulation. You will see that money start gets missing. The money that was used to be enough before is never enough any longer, right? The money is going somewhere. So these are some of the things you begin to see in the individual. For certain substances, because you have to start talking about certain substances now. For certain substances, there are peculiar issues. Might notice that maybe the way the skin will start to become. You see some kind of pattern. In fact, some people, even at the very first instance, for the early first use, you notice that this individual, they are eating, but they are losing weight. Or it appears that they are eating, but they are losing weight. Some of the reasons is not far-fetched anyway, because in terms of the way it feels, the euphoria and then the pleasure from the drugs is better than that you get from the food. So they prefer to sacrifice food to for them to get high. You might notice self-care also declining. What I mean by self-care, I'm talking about things like their hygiene, because the priority has now shifted. So the priority that used to be on other things that matter, school, work, some of the important things in their life changes. So, and because of that, you notice that there's a decline in self-care. So these are just some of the things that you will notice when someone starts to abuse substances.
Okay, sir. So, in your experience, what will you say is the psychological factor that contribute to development of an addiction?
Okay, psychological factors.
Yes.
Well, there's a lot of interplays, right? I know a lot of people do stress about things about peer influences.
Yeah.
Some people are curious. They want to know how it is. I know a lot of people that they will say, well, I've seen this thing. I just want to know how it feels. And unfortunately for them, they want to know how it feels, but boom, they get trapped. There are some substances like that, like crack cocaine, right? If you try it twice, you are gone. So some of them are actually because they are going through underlying issues, actually, truly, right? It could be trauma. Some people, sickle cell, for example, sickle cell anemia, for example, the pain during the crisis, and maybe accidentally they stumble on something, they stumble on pentazocine, they stumble on pentidine, any of these things that makes them feel better, and before you know, they get hooked, right? So there's a lot of interplay. So it could be because of health factors, it could be because of curiosity, it could be a result of underlying issues, and again, it could also be a result of influence as well. But one of the things that we need to start advocating about is just that, there's this issue of morality and, an addiction. So people do drugs, they are bad people. While we might make argument and say that, okay, so what led to that addiction? But the point is just that once an individual starts to use that drugs and the person become addicted, is no longer in that person's control. What they need at that point is not judgment, is not criticism. They need proper treatment, right? They need proper treatment, and it is until when we begin to look at addiction as a medical condition than improper treatment and not a result of moral failure, we still have a long way to go. So, and for us anyway, that's really the advocacy anyway, try to see them as human beings, regardless of who they are, help them to get that help that they actually need.
So we often hear that addiction change the brain. So in your experience, can you explain how addiction affects the brain?
Yeah, definitely. It changes the brain. So if you check an MRI of someone who is addicted and someone who is not addicted, you definitely see, that these changes. Now, there's a part of the brain which you call the dopaminergic pathways, right? So these pathways is actually very, very is implicated when it comes to the reward system of the brain and motivations and all that. Someone who's not addicted to a psychoactive substance or who's not addicted, right? So me and you, we are able to get pleasure from regular things like watching movies, playing games, and all that. That's because our body is the way the dopamine respond is actually, in the way it should be. But a brain that has seen a level of euphoria, dopamine release, that is humanly impossible, is craving for that particular level of euphoria again. So it gets to a particular point when the brain, because again, dopamine is actually what makes us to become excited, motivated to do things and all that. So when that thing happens time again, right, it changes the physiology of the brain actually, such that normal regular activities, you see them, you probably hear people who are addicted to substances, they are telling you that they are bored, that this and this. It's all of this as also a result of these brain changes that we're talking about. Now, let me just explain this. So a simple analogy is this. Say, for example, say someone that is earning 50K a month, right? And the person was able to adjust and all that. So all of a sudden, maybe fortune change and the person start earning 500,000 naira a month. Start earning that amount for like 2 years, and then that person loses his job back to 50K. How would the person cope? You see that changes. So that's the same thing when we say we're comparing people who are not addicted to people who are addicted. So that's just the I will have explained some other thing, but I feel like it might be a little bit too technical for this in a settings in terms of the role of those dopamine and some of those physiology underneath it.
Dr. Peters, can you share more light on behavior addiction like gambling or internet addiction, and how can you compare it with substance addiction?
Okay, so to start with, there are similarities. So the similarity is also it's also implicated in the role by which dopamine plays, actually. Now, so when we say behavioral addictions, we are talking about things that is different from substance. When we say substance, talking about alcohol and other drugs. But behavioral addiction, we're talking about things like pornography addiction, sex addiction, gambling addictions, sugar addiction, and all that. Now, they are similar in the sense that the thing is just that it's also the reward system of the brain. So let me pick something. Let me pick gambling, for example, because a lot of people do not believe that you can become addicted to gambling. So I want to gamble, and the first time I won, the first time I won money, right? Maybe I won, say, 700,000 naira. I'm like, wow, so I can actually win this. There's a level of pleasure, there's an euphoria, right, that is stimulated by the brain, right? And in which the individual is like, oh, so this is actually possible. And to talk about it, right? So the issue of gambling addiction is actually even more dangerous, because for them, right, once they won once, there's always this belief that they can always win again. Right? So so there's always that feeling that they want to replicate that feeling. They can always cash out. And guess what? One of the things that now happens to them is just that sometimes it gets to the point when, even when they are sad, because it's not just about the feeling, sometimes it's about the feeling, the way it feels. So there's something that is stimulating, I'm not feeling well, let me just kind of get this. Just imagine that if I win such amount of money, right, all my problem is all away. So that's need for them to be able to feel better. So the gambling thing is now serving many other purposes for them. It's serving a lot of purpose different from just the winning. So it's about the fact that, so I don't feel so good about myself. So in that case, how can I do? So let me just go and gamble. So if I gamble, right, just the thought or just the imagination that I could win a lot of money, that's something. Even when they've lost about, let's say, 10 times, and maybe in the last 20 attempts to gamble, maybe they've only won one time, but they're always thinking that, so my next bet, will recover all my losses. So it's similar with other addiction as well. It's the role of the dopamine and then the neurotransmitter of the brain that's always seeking for that initial highness, that initial euphoria, that keep that behavior going.
So earlier you talk about trauma. So how does trauma play an onset of addiction, and how can it be treated?
Okay. So in substance use, when it comes to trauma, it's more like a coping mechanism. So I'm interested in trauma. I can say I'm a trauma expert myself. So I work with a lot of people on trauma. So, and this is one of the behavior you see in people undergoing trauma. There are so many forms of trauma anyway. So because they feel like people do not understand them, they don't like the way they are feeling. They feel like it is not. For example, people who traumatize, they're having flashback, they're having nightmare. They just sit there somewhere, and then there's this intrusive thought that just come to them. So you are judging them. Oh, snap out of it. It's not a problem. It's only in your head. But it's not in their head. So, I mean, they're looking for a way out. And then maybe somebody just thought in mind, like, you know what, just take this on. This will help you feel better. Or they've even heard about, oh, alcohol can make me feel better. So they naturally they just resort to alcohol or other drugs as a way of just, helping themselves to feel better. So before you know it, the problem that was only trauma, you now add addiction to it. Because again, too, when you take substance for a period of time, you become addicted, right? You become dependent on it. And once you just stop abruptly, you're going to have withdrawal symptoms, right? So that's in that way makes the problem bigger. So that's the link between addiction and trauma.
So let's come back to the recovery session. What is the realistic recovery journey look like for somebody struggling with addiction?
Hmm. Okay, so we always say that addiction is a lifetime journey.
Okay.
Um, is a lifetime journey. That's the truth. So every day you are working on your recovery. We don't tell people that they've gotten to the point when they've recovered completely. Fine, they may not have been using it for years, but we don't say, oh, the journey stops here.
Okay.
Now, when it comes to helping people with an addiction, the best approach, depending on substance anyway, and then the level of use. So when the person comes, you do an assessment for the person, you see where the person is. So the first thing will be a detoxification. So detoxification is just a natural process by which the substance clear out of the system. And there's something we call medically supervised detoxification, where, because sometimes one of the reasons why it's difficult for people to stop an addiction is because when the withdrawal hits, they cannot handle. Some of them, they may not be able to sleep. They're having teary eyes. They are having, they're having tremors, a lot of things. They cannot manage it. So when they go to a facility, a hospital where it can be managed appropriately, it helps them seamlessly. Do you understand? So after that phase, it doesn't end there. Detoxification just means that your body has been helped to recover from that substance that your body is dependent on, but the cravings will still come. So that's where the proper treatment now comes into play. Actually, the recommended length of rehabilitation should be 6 months, right?
Okay.
WHO standard, 6 months, right? But however, we don't say there's never there's never a one would that fits all, right? There could be motivation and all that, and some of the other things you need to do to just walk around the person lifestyle and whatever it is that the person has in front of him. So, but when you do that, you are providing the person the best framework to help that recovery. Because again, one of the things you want to prevent is relapse. Because what's the point of even doing a short? Some people say, I just want it 1 month. After 1 month, and they have that relapse, and then again they are back to square one again. So that's just the way it goes.
So when it comes to someone loved ones being addicted to substance, how does the family or the loved ones support the said person without enabling the person?
Okay, there's a lot of ways. And again, so the issue of addiction is actually very complex because they say through studies anyway. So when someone become addicted to a substance or particular substance, it affects your family. It's more like if you're treating an
Yes.
individual, you're treating the whole family because
Yeah.
everybody that the person interfered that is important in the person's life, you also interface in them. We usually use the model we call psychosocial model, psychological, social, and biological. That's biopsychosocial model. That's the one we use. Now, so you when you are trying to help an individual, so you don't treat the individual in isolation. You also have to bring in the family for them to know how to help this individual. Because one of the things that family does is just that because they see, like I started, that oh, this is just a bad habit. Just why can't you just snap out of it? Why can't it just be so? Why is it so difficult for you to just? We make them to understand first and say, see, we take them through what we call the science of addiction. This is what it means to be addicted. At a point, this guy could have been able to stop on his own, but now this person needs help. And so you need to be patient. You can't call it recovery, right? These are the things and the things you will need, right? So this is how you talk to this person. This is what trust means because they've broken trust over times. Their behavior has changed. They've lied over times. It's become is very, very difficult for you even to trust what they say. So this is how you can draw the thin line between trusting them and also being supportive and also helping them to, being their accountability partner. So there are certain things the way you do, regular checks. And these are some of those things that we want to help family because when someone have an addiction, we always want to ask, so who are the important people in your life? Are you married? What of your family? Can we have a conversation with them? So when we have that conversation with them, they know their role, they know what to do, they know what to say, right? So as to help that person in the best way possible.
So on issue of treatment, what are the innovative treatment for addiction that show promises for helping people recover?
Okay, okay. So I guess you are referring to what we call the evidence-based treatment.
Mm-hmm.
So the evidence-based treatment I help, let me start from, there are different categories of substances. We have opioids, we have stimulants, we have depressants, we have so many categories. So the modality of treatment differs. It becomes more challenging when we have a poly user, meaning that somebody that use more than one substance. Let me start from the one that has. So usually the practice is that the general is that you want to combine medication and psychotherapy for treatment, right? So what that means is that let me start from opioids. So usually there are medication that helps that supports people with an addiction. Some of them works like partial, egoist, and they like some of them helps to reduce the craving, and some of them when they take those medication, even when they are using some of those substances, they don't get the euphoria that they expect. So they might as well just stop and say, okay, so what's the point of taking the substance when I don't get high, right? But it doesn't just stop there as well. Anyway, so there are some medication that when they come to the hospital, proper mental health facility, they are helped appropriately. I don't want to mention him. So alongside the therapy, so the therapy is talking about the behavioral modification strategies, the relapse prevention skills that they need, peculiar to them that can help them as an individual. So we talk about those things. We review issues. We review their environments. How do you become more assertive? How do you shun peer influences? All of those other things are things that are talked about when they come for therapy session for someone who has an addiction. Now, for stimulant talking about things like crack and the likes. Unfortunately, for now, we don't have evidence-based medication that works the same way it works for opioids. So when they are giving medication, the medication is really to help them for things like restlessness. If they are restless, for example, so there are some medication that could be given to them. But the majority of the work when it comes to stimulants is the psychotherapy bits. So that is where those things comes to play. So we're talking about therapy, that's psychotherapy. We're talking about things like pharmacotherapy, as the case may be. And then we are looking at the social factors of the individual. So when those three components are integrated, usually the prognosis become promising.
Okay, finally, Dr. Peters, let's talk about stigma. As much as we try to protect our young ones, like trying to warn them not to go close to people that are addicted to substance or behavioral addiction, what can we do as a society to help people that are addicted, not to reduce stigma. Let me just put it like that. What can we do as society to reduce stigma?
Okay, I think people will behave the way they will behave based on the information they have. You can't. If I've had an experience with somebody who who had a knife and walk in a certain way, when I see people in that line, I'll probably react that way. So people behave based on what they know, and that's where to change it is now for us to now let them know that, see, there's a lot of myths going out there. There's a lot of misconception that can only end with education, with advocacy. When we have opportunities like this, when we have forum, fora, all of those other things, to let them know that, see, when it comes to addiction is not just a thing that happens to bad people, because that's actually the
Okay.
myths out there. So once you are taking substances, oh, you are a bad person automatically. It's not true, because I have seen people, right? If you look at the circumstance by which they become addicted, you will almost, in a way. So when you look at the circumstance that upon which, if you look at the circumstance upon which they become addicted, you will know that it's actually not their fault. So in that case, so you want to look at it from a different perspective. You want to look at them, with empathy and say, okay, this person, is struggling with this thing. How can I? Because a lot of them actually, they got to that point when they won't stop. But part of the things that make them to continue is because they couldn't deal with the withdrawal that comes with it. So the psychoeducations, enlightenment helps. So for us, when we have opportunity to discuss with family, to discuss with loved one or people who are addicted, we want to let them know that, see, this is how you can support this individual. At a point, it could have stopped, she could have stopped, but now, we've passed that stage. This is what you can do to help this person to, to address this problem. I think that's the bit we can do for now.
All right. Thank you so much, Doctor, for honoring our invitation. Okay.
All right.
That'll
You're
bring
welcome.
us to the end of today's session. Thank you. Tune in next week by this time. Have a nice time.
Thank you for watching. For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word.